Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus New Jersey has been provided by Johnson & Johnson. Choose New Jersey. Our mission is attracting companies to the Garden State. CIANJ, committed to improving New Jersey's economy and strengthening its communities. Kessler Foundation, changing the lives of people with disabilities. New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor. And by Gary's Wine and Marketplace, creating an individual shopping experience for every guest. Promotional support provided by hipnewjersey.com. Live hard, work hard, play hard. You're from New Jersey, and so are we. And by Meadowlands Regional Chamber, building essential connections that drive business growth.
Hi, I'm Steve Adubato. It is my pleasure to welcome for the first time Dr. Steve Landers, President and Chief Executive Officer of a great organization called the Visiting Nurse Association Health Group. Good to see you, Steve.
Good to see you. Thanks for having me.
Steve, let's talk about the Visiting Nurse Association. What is it?
Visiting Nurse Association Health Group, we're a nonprofit organization that works throughout the state of New Jersey, and we help people in home setting, community setting, really on bad days when the chips are down. Maybe they're trying to get out of a hospital and need extra help. We are trying to help people when they're coming home from surgeries, joint replacement surgery, heart surgery, working to help people late in life, at the end of life, with home hospice care, so that families are supported and people can have those days be as comfortable and have as much independence and dignity as possible.
Tough situations, right?
A lot of hard situations, yeah. We're doing a lot of things that people don't like to think about and talk about, those tough days in life, maybe days when you're in the shadow, but family caregivers are working with their loved ones. We have nurses, therapists, social workers out there making hundreds of thousands of home visits a year in Jersey, helping people at those times.
And you actually, by way of background, a family physician, geriatric medicine?
That's right.
Explain that to folks. What does that mean, geriatric medicine?
Geriatric medicine. I'm an elder care specialist. There's actually an advanced specialty of physician training where you can become more knowledgeable about treating older adults. People, they say over 65, but quite frankly, most people that need geriatric care are 85 and above. It's a big growth population, as you know, nationally because of the demographics. Absolutely. Overall,
living longer.
People are living longer, but with the baby boomers, the aging of that generation is really, thousands of people a day are becoming 85 and older. That population is going to triple over the next 30 years. So we've got to, as a state, as a country, really make sure that we're able to help.
How'd you get into it? Why do you care so much about this particular population and the challenges they face?
I'm a family doc originally, and
From
Cleveland. That's right. I grew up in Cleveland, Ohio, and did my medical training in Cleveland, Ohio. Worked at a Cleveland clinic, running their home care, and
not a bad place,
and working in their geriatrics group. And what I learned, when I was in medical school, quite frankly, is that older people, their families, are often not tended to, particularly in the home setting where they want to be. They want to be home if they can. I started making home visits, brought the black bag.
You did?
Did over 5,000 home visits to frail elders, and I'd show up at the door, and the family caregiver would sometimes almost break down just in gratitude that somebody was helping them out, because they're having a tough time. If you're dealing with a loved one with Alzheimer's disease, Parkinson's disease, or stroke, or bad heart disease, and you've been bouncing around, gone to the hospital, maybe in a rehab facility, it's hard. It's hard for the person and the family. And so I realized really quickly there's so much need.
Yeah. There's all kinds of disclosures I make about relationships we have, but this one is a particularly challenging one, but I also need to thank you and your folks. My family does too, because the Visiting Nurse Association has been caring for my dad through hospice, who's been dealing with some really challenging issues for a while now. And I would not have known. I mean, we've done programs on hospice care, but it was hard for our family, for me personally, to really understand what that care was until those nurses and the other clinical professionals came in to do what they were doing, particularly for my mom, who's really been charged with the most responsibility with my dad. It's extraordinary.
It's really incredible, and it's not talked about a lot, not talked about enough. And hospice, the thing is, hospice is more care, not less. When people get
think, right away, people think, oh, so this is it.
That's right. The gut, sort of the knee-jerk reaction is that we've given up. There's nothing left to do. And the fact of the matter is, there's a lot we can do for people with serious late-stage illness when other medical treatments aren't working. We can help make sure that they're not in pain. We can make sure that people have the social support they need with the basics of life. The personal care issues. We can make sure the family's supported and has the right help and equipment in the home. We can help people tend to some of their spiritual issues. Actually, part of hospice care includes pastoral care, and we have reverends and rabbis as part of our staff. So
social workers, they're all there.
Absolutely. There's so much we can do to help people and provide more care, not less. And ultimately, at some point, death is a part of life, and making sure that we help people and families have the most dignified and supported situation, I think, is an important thing, and I'm proud to be a part of it.
Steve, what is the 2020 Vision Campaign?
The 2020 Vision Campaign is an effort by Visiting Nurse Association Health Group to raise money for our philanthropic services. These are things like what we call Advanced Care Institute. This is palliative care, hospice care, and home visiting physicians. We actually have 30 physicians and nurse practitioners that are doing home visiting medical care in the state of New Jersey. It's a hard thing to get up and sustain, and the support that we're getting through the 2020 Vision Campaign is helping that go. Another area we haven't talked about yet that Visiting Nurse Association is very involved in is actually children's health care. Many children that are dealing with things like developmental issues, autism and other developmental spectrum concerns. Maybe they're in socially vulnerable situations in high poverty neighborhoods. We have nurses and community health workers that go out and work with those families, trying to make sure that they get the type of services that they need, make sure that they're on a path to have, basically accomplish as much in life as they can. They're working with pregnant women in high poverty neighborhoods, trying to help them be in a safe situation where they're less at risk for domestic violence and other bad outcomes. That's our Children and Family Health Institute.
What is the Connective, help me on this, the Connective Health Institute?
That's right. We have
Connected Health Institute.
Connected Health Institute.
Give me 30 seconds on that.
Yeah, the Connected Health Institute is an effort of ours to use mobile and digital technology to do all the things we've been talking about better. So we feel like if we're going to be great at home health care for older people, hospice care, children and family health services, we want to use that modern information technology, video conferencing into the home, apps so that people can access us off hours, better communication between our staff, remote monitoring to the home where people are having their vital signs, the blood pressure checked, their weights checked if it's relevant to their care remotely. Our Connected Health Institute, which is part of that 2020 Vision Campaign, is where we're really innovating to not just provide all of the things we know that are important about home care, but also to find ways to do it better and to innovate.
Dr. Stephen Landers is the President and Chief Executive Officer of Visiting Nurse Association Health Group. Steve, I want to thank you for joining us and you and your colleagues for what you do every day for so many people who need that help. Thank you so much.
Thank
Stay
you.
Right there. We'll be right back right after this.
To watch more Caucus New Jersey, find us online and follow us on social media.
We're talking leadership. Just finished a terrific forum at the Commerce and Industry Association. Kathleen Waldron, who is the president of William Paterson University, right in the middle of that distinguished forum with Ralph LaRosa, the president of PSEG, and Mike Marin, who heads up Holy Name Medical Center. Biggest takeaway for you on that leadership forum that you were right in the middle of?
I was amazed at both of these gentlemen having 32 years experience in the same company, which is something that is so rare and you don't find that anymore. So they rose up through the ranks to their leadership position, which is a lesson probably that young people haven't heard or don't know about, that people have made their careers that way.
What's interesting for you, you had a career before you entered academia, a very successful career in the corporate America in banking, right? So if I were to ask you the biggest leadership difference or leading in corporate life versus in academic life, it would be?
It would be that corporate life is much more hierarchical, and university life is consensus and shared governance with the faculty, which is a unique concept of American universities, which makes them great.
Wow, hold on, wait a minute. So, devil's advocate. So the president of the university can't simply say, all right, look, here's the way we're going to do this, faculty. We're going to do A, B, and C, and the faculty says, okay, Madam President, we're on board. Doesn't happen that way?
Never happens that way.
What is it like?
It's really an intellectual engagement. Faculty are intellectuals. They are deep thinkers. They've spent their lives pursuing their disciplines. So they come at a problem or even a suggestion from a very analytical, thoughtful way. Now, they're going to take a long time to think about that compared to a corporate pace of change or innovation. And that's where sometimes you can get conflicts or resistance. But in the end, you're better for the thoughtful decision-making and thoughtful analysis that faculty do.
But is there a part of you, knowing how quickly things are changing around us, knowing the need to adapt to these situations and to be ahead of the curve, if you will, and also the competition that you face, that you say, hey, wait a minute, look, I know we need to have a discussion, I know we need to have a lot of discussion, but come on, we've got to move faster.
Yes, and I've said that. Come on, we have to move faster.
And the reaction?
Sometimes yes, sometimes no, but most of the time people understand. And then I appeal to the business school, the Cotsacos College business faculty, and people who have worked in externally outside of a university to move the pace of change. And at William Paterson University, we have 400 full-time faculty, many of whom have had corporate or not-for-profit or government experience, so they get it.
Biggest leadership lesson that you have learned in your few years of professional life would be?
The biggest leadership lesson I've learned is to not always think that you're the leader. To be, as Mike Moran said, humble sometimes. That you're not expected to know all the answers. You're expected to lead in crisis. You're expected to get people behind you. And if you don't articulate a vision, and if you don't have integrity, day to day, month to month, people will not follow your vision, will not follow your leadership.
But there's an interesting balance here. I often think about this. My own questioning about my own leadership style. I'm sure others who are watching right now as leaders, you ask this. What is the balance between showing that confidence? You know, I do have a sense of where we need to go, but at the same time, the humility and the vulnerability to communicate, hey, wait a minute, I'm not that sure.
Mm-hmm. I think people get nervous when you say, I'm not that sure. And it doesn't mean that a leadership or a vision can't do a course correction or a change. In higher education today, there are a lot of external pressures on universities that didn't exist 10 years ago or even 5 years ago, and we must be very mindful of those. College affordability is one of them. College affordability is driving a lot of decision-making at universities around the country, but it's also a challenge to talk to government leaders about the necessity for investment in higher education as a benefit to society overall. And as a leader, I need to keep delivering that message, not only to the faculty and students, but also to a larger community.
It's often said that great leaders understand the need to tell those around them things that they really don't want to hear. The great Colin Powell, in my book, Lessons in Leadership, I quote him saying sometimes, I might get bleeped on public broadcasting, our brothers and sisters might bleep this, great leaders sometimes, quote, piss people off. You say?
I agree. I agree. And Colin Powell was a great leader because he could assess a situation, and I met him and talked to him about leadership at one point in my life. I was lucky enough to do that. And what you sensed about the man was that he was a listener as well as a leader.
But when he was talking about that, he said to me, when I interviewed him about this subject a few years back, he said, Steve, you don't intentionally try to get people angry at you. That's not your intent. But the truth is, if you're not making those tough decisions that people often may not like, that means you're actually not being a leader. So if people are pleased with you all the time, that means you have failed. So if they're not peeved with you, something's wrong. Is that making sense?
It does, and you need thick skin. Because you're not going to please all of the people all the time. You have different groups that you're leading. And so if you never take a controversial stand, if you never take a firm stand, if you are always trying to win the popularity contest, you're not leading.
Well said. Thank you so much.
You're welcome. Thank you.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
Hi, this is Steve Adubato. We're coming to you from beautiful Camden, New Jersey. It is our pleasure to welcome our longtime friend, Rich Miller, who is the President and Chief Executive Officer at Virtua. Good to see you, Rich.
Good to see you, Steve.
This is your neck of the woods.
Yeah, it is. You're here in South Jersey. It's great to have you down here.
Now, when I got word not too long ago that Rich Miller was in fact stepping down at the end of 2017?
Correct, yes.
I said, wow, you've had an impressive, important career here. Why is it time for you?
Well, you know, actually this decision was made a couple of years ago, Steve. I mean, my wife and I talked about it 2 years ago, and I signed a 3-year contract and told my board that would be the end for me. So this has been in the planning mode for a couple of years, and frankly, been CEO for 21 years.
Has it been?
Yeah, I'll be 65 at the end of the year, so I said, it's time to do other things. I want to do other things in life, and I've done enough and done good stuff at Virtua. I'm really pleased with where it is. Time to do some other things.
Let's talk about it a little bit, big picture. Mm-hmm. And we've known each other a long time, and Virtua has in fact been an underwriter of our programming in public broadcasting for, I don't know, about a decade or so. But what I'm curious about is this. If you were to say one or two of the biggest lessons that you have learned as CEO at Virtua in this always evolving healthcare environment, biggest would be?
The biggest lesson I learned, I think, as a CEO is people are your most important asset, and having great people make great organizations. So, and I also will tell you that building culture takes a long time. And when I became a CEO at age 42, I thought I could build a culture in 2 weeks, and and I learned how stupid that was, and it takes a long time. But building great organizations revolve around great people. And as I look back, Steve, over 21 years, we're there. I mean, we've gotten there, and we've gotten there through hiring good senior leaders, and senior leaders beget great leaders throughout the organization.
Let's talk about the incredible changes in healthcare. So one of the things we've talked about over the years, Rich, is the delivery of healthcare and how it's changed dramatically. Describe where you believe we are today, but even more challenging, where you believe we think we're going over the next 3 to 5 years.
Yeah, I mean, I think I've seen a lot of changes in healthcare from basically years ago being a hospital model of care. Build it and they will come. People would come to the hospital for care. I mean, most of my business when I started as a CEO was inpatient. I mean, I would say it was 70-30.
They come to the hospital, stay for X number of days.
Go home, treat them, and our outpatient model wasn't that significant. That has completely shifted now, and when we sit here in 2017, to a model where outpatient becomes very important. So, you know, we're seeing knees and hips in 24 hours being done, surgeries being done.
I mean replacements?
Replacements, yeah.
In 24 hours?
24 hours.
Not the case 10 years ago?
Oh, 10 years ago it was a couple-week, 3-week stay. So now, you know, we're seeing technology turn around, and surgeons turn, you know, we're talking about hips and knees being put in with 1-inch scars. I mean, that's the kind of surgery we're seeing today. So the whole environment has evolved to an outpatient environment. And I would say 55% of my business today at Virtua is outpatient.
But beyond that, the delivery of healthcare also is being driven not just by technology. You've also talked to us about the demands that consumers, that patients and the families demand healthcare be delivered in a different way. Talk about that.
Well, I think part of, and people demand it because the cost is so high. And once you come into an emergency room, Steve, in any hospital, the cost goes up dramatically, because if you're 9 out of 10 times or 70% of the time, you might be admitted to the hospital. And right there, the cost goes up. So the goal is now, and what you're seeing in healthcare, urgent care, minute clinics by CVS, even other retailers putting in primary care centers. And the reason for that is to keep people out of the high cost arena, which is the hospital. So that whole cost environment where now, a premium dollar for the average individual in the street's very high. Right. And then you add on the cost of copay and deductible, which are going through the roof right now. People can't afford health care. So you want to keep them out of the hospital setting as much as you can and into lower cost settings.
One of the things that I'm always curious about for a CEO of a large healthcare system or a large organization is how much is unpredictable. So as we're doing this program, taping this program, as we move into the spring of 2017, it'll be after that as well, we don't know what the healthcare landscape is going to look like in Washington and how that's going to impact New Jersey, hospitals in New Jersey, the healthcare delivery in New Jersey. So as the Trump administration does what it's going to do, Congress does what it's going to do, or not, we don't know. How the heck do you plan? How do you and your colleagues plan when you don't know what's going to happen?
Well, that's been the case for many, many years.
It's not different now, Rich?
Well, the reimbursement system, the way hospitals are paid, has always been a different. I've been through maybe 10 different models of payment.
How do you plan in that environment?
It's very hard. I remember when we had the all-payer, single-payer system in New Jersey back in the 80s and 90s, we were paid one rate for everything.
Is that the DRG
system? And I went through that process, which was supposed to be a prospective payment system, Steve. It turned into a retrospective payment system.
I can't even believe I remember this acronym. I think it was called the Diagnostic Related Groups.
Right.
So somehow if you were diagnosed in a certain group, you got a certain payment for that?
Correct. And
Sounds
frankly,
simple, but
it was hard because you were paid off of what they call a base year, which could have been 3 years ago, and then you couldn't recover if you had a bad low-cost base year. It was a nightmare. So I've been through that scenario. I've been through a number of. Then we deregulated in New Jersey in the 90s, and we moved to a deregulated environment where now you're negotiating rates with payers, and there's all different rates for all different disease categories. So the payment methodology will always change.
But what?
But the issue is going to be today, and I think the bigger issue is where does Medicaid go? And that's the one area, Medicaid. That's the one area now where, under the Affordable Care Act, the states were getting paid 90% on the dollar here for Medicaid.
From the feds?
From the feds. So if that goes back to the states to manage.
In block grants?
In block grants, which is a possibility, will there be enough money to take care of the Medicaid population in the state? Because frankly, New Jersey doesn't have the money to support a Medicaid program. And that's where I get worried, because people were covered right now. There was a lot more people that in underserved areas that had Medicaid coverage today because it was being paid for. And I think that's a good thing. I think the underserved population needs health care, and we need to take care of that population. So what happens if it goes back to the states and there's not enough money to pay for it? Or are those people covered? And you couple that with the fact that the state's phasing out the charity care program funding, that could create a huge hole for a lot of providers.
Rich, real quick, explain that charity care situation. People hear the term all the time. Charity care is?
Charity care charity care is for patients that really have no insurance.
So they come into the emergency room.
Right.
You have to, by law, treat them?
Yeah, by law.
And then what happens with that bill?
Well, what happens to the bill is, Virtua, for example, has its own charity care program where we discount significantly the bill for a patient. But typically, a lot of times, we don't receive payment for that. So charity care is no pay. Medicaid, at least, if it's 50 cents on the dollar, it's 50 cents on the dollar of cost. at least you're getting something. For charity care patients, you're getting nothing.
If I were to ask you what you're most proud of in your 2+ decades as the CEO of this organization, could you pinpoint that?
I mean, there's a lot of things I'm proud of. I will say it's building a culture of care at Virtua that's very special. I mean, to me, that we did our STAR initiative back in 2000, 2001, which was to build the culture. And people really gravitated to that because it's centered around the patient. So I would say if all the things we accomplished was building a culture of care that's very special and palpable in our organization and resonates in our community, because we're the healthcare organization of choice. And we're that because we provide great care, but we provide it in a way of compassion and caring that most don't. Many providers do, but not to the level we provide it.
Rich, we usually do not do this as broadcasters in public television, but I just want to say, because you've made this decision and you'll be off doing other great things. But I want to thank you for all the work that you've done in the healthcare community and the work that you've done at your place at Virtua, and we wish you nothing but the best.
I thank you, Steve. I look forward to the future. There's a lot to do, and I look forward to doing it and doing things that I think can help community as well. Thank you so much. Appreciate it, Steve.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Johnson & Johnson, Choose New Jersey, CIANJ, Kessler Foundation, New Jersey Sharing Network, the New Jersey Office of the Insurance Fraud Prosecutor, and by Gary's Wine and Marketplace. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
Think this is absurd? Insurance fraud costs every New Jersey family over $1,300 every year. Report fraud at njInsuranceFraud.org.